Welcome to the lesson on Self-Care Heals Shoulder Pain. This lesson focuses on those steps that you can do immediately to begin healing process and get relief of shoulder pain. Research has found many specific self-care strategies can help you do this. Let me explain. For both chronic pain and mild to moderate acute injuries, Self-Care Heals routine will begin the healing process and relieve your pain sooner. You should begin this now. HEALS protocol stands for H for heat, cold, and massage, E for exercise, including stretching, strengthening, and normal functioning, A for analgesics, including anti-inflammatory, pain-relieving medications. L is for lifestyle, focusing on diet and sleep. S is for strain and stress reduction. So let's review each one. H is for heat, cold, and massage. These encourage relief and healing of the muscles and joints. First, try a heating pack. This can be a moist towel that is put in a microwave, not too hot, and then place it on your neck and shoulders, or your jaw, or the other muscles that are sore. Or you can use a wet cold pack that has been in the freezer for a while, and place that across the muscles and joints that are sore. Or you can alternate heat and cold. All of these provide counter-stimulation to encourage relief and healing. Then also apply gentle relaxation massage by taking your fingers and gently massage the muscles that are sore in your neck and shoulders or your jaw or other areas. You may also use deep muscle massage to reduce pain from myofascial trigger points. First, use your finger to find the tender muscle knots called trigger points that reproduce your pain. Then use your finger, thumb, or a massage tool such as a knobble to massage the trigger point firmly for a few minutes. This hurts a bit, but also feels good. Then gently stretch the muscle. This will reduce tenderness and give you some relief from the dull pain. The next is up to you to reduce strain to the muscle during the day to prevent the trigger point from recurring. The next is E for exercises that include stretching of the upper back. This will improve range of motion, function, posture, and pain in the upper back and shoulders. Turn your head to one side and point your chin to that shoulder. Use your opposite hand to gently pull down the head to stretch your neck and shoulders. Then count to 10. Rest, and then repeat 6 times. The next exercise is stretching the back of the shoulder. This improves range of motion, function, posture, and pain in the back of the shoulder, and particularly the trapezius muscle. Move your arm across your body to your opposite shoulder. Take your other hand and pull the other arm towards your body, feeling the stretch in the back of the shoulder, as illustrated in the picture. Push this to the point of pain and not beyond. Hold this for a count of 10, then rest, and repeat 6 times. Here's another exercise that stretches the front of the shoulder. Like the others, it improves range of motion, function, posture, and pain in the shoulder. Stand in a doorway and hold each side of the door frame as illustrated here. Gently fall forward holding the door frame while stretching the front of the shoulder. Push to the point of pain and not beyond. Hold this for a count of 10, then rest it, and then repeat 6 times. A is for analgesics. The best analgesics to use for musculoskeletal pain is anti-inflammatories, or NSAIDs. They can reduce pain and inflammation quite effectively. Some of the examples of these analgesics include ibuprofen, aspirin, naproxen, and even placing topical analgesics on the skin will help alleviate the pain. Use this regularly for several days. It'll work quite well. Now the question comes up about, should I use opioids for my pain? We recommend avoiding opioid narcotic medications since there are a lot of concerns expressed about the safety of long-term opioid administration. As you'd expect, it can lead to adverse events, increased pain and tolerance to the analgesic effect, addiction, and even drug diversion. Most current pain guidelines do not recommend the use of opioids for chronic non-cancer pain, and they reflect the concern over these problems. Some people are on opioids or have expressed interest in considering opioids for the pain. It is important to note that opioids are strong painkillers. In one study, 42% of workers with neck and back pain received opioids at their first visit. However, 38% of them were still on opioids at 1 year and still had pain. In addition, systematic reviews of clinical trials have showed that opioids, when compared to anti-inflammatory medications, have similar efficacy. Yet the opioids have higher side effect profile than anti-inflammatories. It's best to stay away from opioids. Here are some of the side effects of opioid medications. As you can see, opioids had a much higher side effect profile than placebos. They had more adverse events. They had adverse events upon withdrawal, lack of efficacy, dry mouth, nausea, constipation, itching or pruritus, dizziness, drowsiness, and vomiting. Here's the big concern about opioids. Is addiction a problem? In the past few years, opioid use and the death rate from opioids have increased dramatically. Here are some of the numbers. Drug overdose deaths, 40,000. Unintentional overdose deaths, 15,000. Non-medical use of prescriptions, 12 million. Cost to insurers, 72 billion. Emergency room visits, 500,000. And total workers' compensation costs is about 15 to 20% because of the adverse events. L is for lifestyle. Eating well and sleeping well every night. With regard to your diet, eat a pain-free diet. This includes lots of water per day, 8 to 10 glasses. And your main meal should be large salads with lots of fresh vegetables and fruits. And have some protein, including fish, poultry, legumes. And brown rice, aged bread can be a good supplement. However, to avoid sugar to reduce inflammation. And reduce use of regular caffeine to avoid rebound headaches. And avoid excess of chewy foods for jaw pain. And be modest in alcohol, beer, and wine. L for lifestyle also means getting a good night's sleep every night. This will encourage healing and relaxation of the muscles and joints. Here are some suggestions on doing that. Make sure your room is dark, quiet, and cool. You'll sleep better. And make sure your mattress and pillow is comfortable and medium firm, and the pillow supports your head and without pressing on the jaw. And then get plenty of exercise and no naps during the day. This will make sure you're tired when you go to bed. And then practice calming before bed. Try to avoid exciting books or television shows before bed. And natural sleep aids occasionally can be helpful, but do not do them on a daily basis. And the last letter of HEALS, S, is for strain reduced. To encourage healing, it is important to reduce repeated tensing habits that put strain on the muscles and joints. For the neck and shoulder, this means reducing forward head posture with texting, shoulder and neck shrugging and tensing, sleeping on your stomach, which strains the neck and shoulders, neck strain from typing and computer use, particularly with your head forward, bracing the phone between your ear and your shoulder, slouching while sitting in a chair. Carrying heavy purses or backpacks on one shoulder will strain the neck and shoulders. Turning head to one side for hours with a screen. And rounding shoulders down and forward will all contribute to muscle tension and pain. You can also reduce strain from poor posture by maintaining a balanced, relaxed posture for the neck and shoulders. For sitting, sit with the bottom back against the chair and then lean back with your head balanced over the neck. The shoulders should be relaxed and down. When standing, try to keep your head up, balanced over the neck. The shoulders should be again relaxed back and down. Be mindful of maintaining this balanced, relaxed posture throughout the day. Avoid a forward head position. In addition to reducing direct strain to the muscles and joints, it's important to reduce overall stress. You need to learn to cope with resilience to stressful events. You kind of got to go with the flow. And then reduce muscle tensing when you're under stress. Take a deep breath and practice calming. And then finally, shift from negative emotions. First of all, be mindful of your emotions throughout the day. Take a quick pause to determine them. And then shift to positive emotions through creative actions. These are all reviewed within other lessons. It is important to realize that self-care does heal pain. So follow these self-care guidelines. Try to follow them on a daily routine. You'll notice that pain will improve gradually, but will fluctuate up and down. It'll get worse and it'll get better, but gradually improve. And make sure you identify and reduce risk factors and boost those protective factors and actions in the 7 rounds to improve long-term healing. You can learn all of this from the lessons ahead.